Take a moment right now and look at your fingers. Are some knuckles noticeably enlarged? Does gripping a jar lid send a sharp ache through your hand? Do your fingers feel stiff and locked up every morning, before you can even make a fist? Millions of people chalk these symptoms up to aging and move on. But here is the critical question. Almost nobody asks, is that joint pain osteoarthritis? Or is it rheumatoid arthritis? Because the answer changes everything about what happens next. These two conditions are not simply different names for the same problem. They have entirely different causes, entirely different progression patterns, and entirely different treatment paths. Mistaking one for the other is not just inconvenient. It can be genuinely dangerous. Leave rheumatoid arthritis undiagnosed for even 6 to 12 months, and the joint damage that accumulates during that window can become permanent and irreversible. In Korea, studies show the average time from first symptom to actual diagnosis of rheumatoid arthritis is 1.8 years. That delay costs patients function they will never fully recover. Today, you are going to learn exactly how to tell these two conditions apart. First, the numbers. Osteoarthritis is by far the more common of the two. Radiological signs of hand osteoarthritis appear in more than half of women over the age of 65. And the condition accelerates sharply after age 50. Rheumatoid arthritis is less common but more systemically dangerous, affecting roughly 1 to 2% of the global population, and rising to about 5% in women over 55. In Korea alone, the 2024 patient count reached approximately 246,858. Critically, about 75% of rheumatoid arthritis patients are women. And the condition can appear at virtually any age, including young adults in their 30s and 40s. Now let us get to the core of what separates them. 6 distinguishing clues. You can check yourself, right now. The first and most definitive clue is which joint is affected. Your finger has 3 joints. The joint closest to the fingernail is the distal joint. The middle joint is the proximal joint. The large knuckle at the base, nearest your palm, is the metacarpal joint. Osteoarthritis characteristically attacks the distal joint, the one closest to the nail. When bone spurs form there, they create firm, hard lumps called Heberden's nodes. If the same kind of hard bony growth appears at the middle joint, it is called a Bouchard's node. These lumps feel like bone. They are dense and unyielding. Rheumatoid arthritis, by contrast, almost never affects the distal joint. It targets the middle joints, the large knuckle joints, and the wrist. If your fingertip joints are the problem, osteoarthritis is far more likely. If your middle knuckles and wrists are swollen and tender, while your fingertips are untouched, rheumatoid arthritis deserves serious consideration. The second clue is morning stiffness duration. Both conditions can cause hands to feel stiff on waking, but the duration is clinically decisive. Osteoarthritis morning stiffness typically resolves within 30 minutes. A bit of movement and warmth and the hands loosen up quickly. Rheumatoid arthritis morning stiffness routinely lasts longer than 1 hour, frequently extending through the morning or even into the afternoon. Major international rheumatology guidelines treat morning stiffness lasting more than 1 hour as a strong signal of inflammatory joint disease. Time it. 30 minutes or less points toward osteoarthritis. Over 1 hour points strongly toward rheumatoid arthritis. The third clue is the pain pattern. Osteoarthritis pain is mechanical, meaning it worsens with activity and eases with rest. Hands hurt more toward the end of a busy day, and feel relatively better in the morning. Rheumatoid arthritis pain does not follow this logic. It persists at rest, can be worse after prolonged inactivity, and frequently wakes patients from sleep in the early morning hours. Movement sometimes brings mild temporary relief, which is the opposite of what osteoarthritis does. The fourth clue is the quality of swelling. Osteoarthritic swelling is hard and structural. The joint has physically changed shape from bone remodeling. Rheumatoid swelling is soft and boggy, like a fluid-filled balloon, because the joint lining is inflamed and saturated with inflammatory fluid. Warmth and redness over the joint are additional signals of active rheumatoid inflammation. If you press gently on a swollen knuckle, and it feels soft and warm rather than hard and cool, that matters enormously. The fifth clue is systemic symptoms. Osteoarthritis is a local joint problem. There are no fever, no fatigue, no whole body symptoms. Rheumatoid arthritis is a systemic autoimmune disease, and frequently announces itself with persistent fatigue, low-grade fever, unexplained weight loss, and general malaise, sometimes before the joint symptoms even become prominent. If your aching hands come packaged with exhaustion, and a persistent feeling of being unwell, that combination strongly suggests rheumatoid arthritis. The sixth clue is symmetry. Rheumatoid arthritis has a strong tendency to attack joints on both sides of the body, simultaneously and in mirror image. Left middle finger aches, right middle finger aches in the same spot at the same time. Osteoarthritis is more asymmetrical, tending to be worse on the dominant hand, or the more heavily used side. Perfect bilateral symmetry is a notable red flag for rheumatoid involvement. Blood tests can confirm what your self-examination suggests. In rheumatoid arthritis, the anti-CCP antibody test carries a specificity of up to 97%, meaning that if this antibody is present in your blood, the likelihood of rheumatoid arthritis is extremely high. The rheumatoid factor test adds further evidence when positive. Inflammatory markers including CRP and ESR are typically elevated in active rheumatoid arthritis and normal in pure osteoarthritis. If your doctor orders these tests for finger pain, they are not being overly cautious. They are performing the most reliable step in distinguishing the two conditions. For daily management while you seek diagnosis or alongside treatment, here are practical actions for both conditions. Gentle heat soaking hands in warm water for 10 minutes before activity improves flexibility for osteoarthritis. For rheumatoid flares with active warmth and swelling, cold packs applied for 10 to 15 minutes reduce inflammatory response more effectively. Range of motion exercises, slowly opening and closing each finger 10 times twice daily during low pain periods, benefit both conditions by maintaining joint flexibility. An anti-inflammatory diet rich in omega-3 fatty acids from fatty fish, like mackerel and salmon, combined with reduced intake of processed foods, refined sugar, and saturated fat, supports both conditions meaningfully. Your 7-day self-assessment plan works like this. On days 1 and 2, keep a symptom diary record morning stiffness duration, note which joints are swollen, and photograph them for comparison. On day 3, introduce either warm, soaking or cold packs based on whether your joints feel stiff and cool or warm and inflamed. On days 4 and 5, add gentle finger exercises twice daily. On day 6, audit your diet and substitute one meal with anti-inflammatory options. On day 7, review your diary. If morning stiffness exceeded 30 minutes on multiple days, if joints felt warm and boggy, rather than hard and bony, or if fatigue and low-grade fever accompanied joint symptoms, make an appointment with a specialist without delay. Emergency red flags that demand prompt medical evaluation include morning stiffness, lasting over 1 hour every day, visible redness and warmth over joints, 3 or more joints, swollen simultaneously in a symmetrical pattern, whole finger, sausage-like swelling, and systemic fatigue or fever lasting more than 2 weeks. These are not symptoms to manage with home remedies alone. The bottom line is simple. Hard bony lumps at your fingertips that hurt after activity and loosen within 30 minutes point toward osteoarthritis. Soft, warm, symmetrical swelling at the middle knuckles and wrists with prolonged morning stiffness and systemic fatigue points toward rheumatoid arthritis. Both deserve proper diagnosis, but rheumatoid arthritis demands urgency. Early treatment changes the long-term outcome profoundly. Your joints are worth protecting. Do not wait. If this video gave you clarity, subscribe and share it with someone whose hands have been hurting. Tell us in the comments which symptoms you recognized. It helps others who are searching for answers find their way to this information.